here's what here's the last one.
No, don't.
Yeah.
It is very important for one to recognize the symptoms of an acute heart attack, as well as the causes, because early treatment of symptoms is crucial to the survival of the individual affected by acute myocardial infarction, also known as a heart attack. You're sitting in your chair and you feel a little discomfort in your chest. The sudden onset felt like someone dropped a ton of bricks on your chest. It radiates down your arm, your jaw hurts, you have shortness of breath, and your back hurts. You have nausea, vomiting, lightheaded, and you have cold sweats. You reach for the phone, call 911. While emergency help is on their way, you're hassling to breathe. The elephant that was in the room is now sitting on your chest. The 10 minutes waiting on an ambulance to come, you are realizing the rude awakening of how one comes to being in this condition is staring you in your face. Now that you are in this condition, the simple things you could have done to prevent this from happening does not seem hard. To begin, I would like to discuss what an acute heart attack is and the causes. Here I have a diagram of what a heart attack is. If you'll notice on the artery right here, this is called plaque. This is what stops the blood flow from going through your heart into your body, and this will cause a heart attack by not eating things that's not good for you, by smoking. And then right here, this is the coronary arteries. The left anterior descending artery is called the widowmaker. If you have a blockage in this one, this is the major heart attack. An acute myoinfarction is generally caused by a blockage in the coronary artery. Myo means muscle, cardial refers to the heart, and infarction means the death of a tissue due to the lack of blood supply. Coronary vessels supply nutrients and oxygen to the myocardial heart muscle. The heart muscle, like brain cells, works collectively to form the structures of the heart and will not live long without oxygen. The heart cells works by automaticity, which is nutrients, sodium, and potassium supplied by the blood is pumped in and out of the cardiac cells to cause a repetitive impulse that makes the contraction of the heart muscle. And about the left anterior descending artery, causes a heart attack, like I said about the widowmaker. The widowmaker is the most serious heart attack one could have because of its effects of on the most heart muscle part of the heart called the left ventricle, which pumps blood throughout the whole body as well as demands the most coronary blood flow because of its muscularity. Statistics show that adults from the late 30s until senior age are at high risk of heart attacks, especially stressed individuals. Heart attacks may occur when you are resting or asleep, after a sudden increase in physical activity, when you are active outside in cold weather, after sudden severe emotional or physical stress, including an illness. Next, I want to discuss the ways of detecting and preventing a heart attack. American Heart Association publishes warning signs because that is the number one nation's killer. Approximately 452,000 die from an acute myocardial infarction before they get to the emergency room every year. Some heart attacks are sudden and intense. Most are slow with mild pain and discomfort that lasts more than a few minutes. It has an uncomfortable and squeezing pain. Symptoms can include pain in the neck, jaw, back, and stomach, shortness of breath, cold sweats, lightheaded, and nausea. The pain usually lasts longer than 20 minutes. Rest and a medicine called nitroglycerin may not completely relieve the pain of a heart attack. Symptoms may also go away and come back. Other symptoms of a heart attack include anxiety, cough, fainting, dizziness, palpitations, feeling like your heart is beating too fast or irregular, shortness of breath, sweating which may be heavy. Some people, the elderly, people with diabetes, and women may have little or no chest pain, or they may have unusual symptoms, shortness of breath, fatigue, weakness. A silent heart attack is a heart attack with no symptoms. Why don't people act fast? Most wait more than 2 hours before getting help because they are embarrassed of false alarms. Most people are afraid of having a heart attack and convince themselves that they are not having one. How can you help to avoid a heart attack? Don't smoke. Avoid other people's that smoke. Treat your high blood pressure. Eat foods that are low in saturated fats, trans fats, cholesterol, and salt. Be physically active. Keep your weight under control. Get in regular medical checkups. Take medicines that is prescribed to you. Control your blood sugars if you have diabetes. And if you know we have holidays coming up, Thanksgiving and Christmas, and we all like to eat. But just keep in mind when you're eating these foods that a lot of Thanksgiving foods are high in fat and calories, and that's fine if you do it in moderation. But just remember to limit yourself during the holidays to take care of your body. How can you learn more? Talk to your doctor, nurse, or other healthcare professionals. Call or visit the American Heart Association to learn more about heart attacks. In conclusion, understanding the importance of a heart attack and its risk factors are important to having a healthy life. There are simple steps that you do in your everyday life that can protect you from having a heart attack. You just have to be willing to take a few minutes every day to achieve those goals. You can achieve anything if you are educated enough about the subject to work toward a good outcome. The more you know about what causes a heart attack, the more you can work toward achieving the activities that you can do to prevent it, such as daily exercise, no smoking, eating good, balanced, healthy meals, things that we take for granted every day.